Hi, Michael. It's a pleasure to meet with you today. I want to do a testimonial and gather some information about what your experience has been using cannabidiol for your particular symptoms. So, can you tell me a little bit about what problems you've been facing?
Well, doctor, I'm a Gulf War veteran from Desert Shield, Desert Storm, and I've been having a whole host of medical conditions and issues that were unexplained. For example, virtually every lymph node in my body was swollen, and I've had two surgeries in which they removed the lymph nodes for further examination. They weren't able to determine the cause of the swollen lymph nodes. Um, just achy joints, achy muscles, and things of that nature. And and this is when I was a lot younger and a lot healthier, um, and in better shape, in a prime condition. And I would just have these aches and pains that they weren't able to determine as to the cause.
Tell me about the PTSD that you have.
Oh, it's just um, anxiety related, hyper alertness, a more reactive to unknown sounds and noises around me. Um,
What about isolation?
well, I have a desire to not go out and be as social as I tend to, as people know me to be. I'd rather just stay at home and be around the safety and security of those that I'm closest to.
What have you done to treat these types of problems in the past?
Well, I was on different medications that the VA would provide, and they didn't provide as much relief as I was anticipating.
So, how did you get introduced to cannabidiol?
Well, I was trying to self-medicate with cannabis, CBD, um, but there were too many side effects. I didn't like the altering of my mind and my senses, because some of the cannabis, although they were low in THC, they still had THC in it, which you know causes a psychoactive feeling in one's brain from using cannabis, and so I just stopped that treatment.
Did it help your symptoms at all?
It did, minus the psychoactive feeling, the loss of cognitiveness, if you will, because I didn't feel as though I had the clarity and of the mind that I had when I wasn't on it. So that's a big reason why I stopped.
But then I introduced you to the elixinol, the
Yes,
liposomes.
yes, and it's been a godsend. It really has. It really has, because I don't have the normal everyday aches and pains that I was experiencing. My mental clarity has improved considerably. Um, my sleep, because I'm not in so much pain, I'm able to get a deeper, more restorative sleep, um, and able to function a lot better. I'm able to do more things, be more active around the house and in the job, and just enjoy life a lot more.
How about the anxiety level?
I really don't suffer much from that since your introduction to the CBD. So I really don't think it's a problem.
How about socialization, meeting with other people?
My wife thinks I'm a little too social now because I'm always out there. We'll go to the store, and then she looks around, and I'm off talking to some stranger, and I just don't have that issue anymore.
How has your life changed, or how do you see it going forward, having discovered this particular cannabidiol?
Well, going forward, I feel like there's hope for the future, because there's not the pain that I experienced, on a daily basis. I don't have that anymore. I don't have the frequent muscle spasms anymore, because I would have these just god awful low back muscle spasms that would just take my breath away and make it difficult for me to do anything, get out of bed, return from a seated position, or even go from a standing position to a seated position was problematic, and it was just hell. And so now I don't have those things, because I take it internally and topically, you know, so that if my muscle spasms in my back, for example, start to flare up, then my wife, she'll put some of the topical cream that we have mixed with CBD in it, and it just takes care of it, and it's a beautiful thing.
This is fabulous, Michael. Thank you so much for participating in the study and using CBD and allowing us to capture your testimony on this.
My pleasure. Thank you.